Good evening and welcome, everyone. Most of you know me. I'm Sherry Dayton. From those who don't, I'm president of 5149 Backus Federation of Nurses and also divisional vice president for AFT Connecticut for nurses and healthcare professionals. I wanted to let you know that the webinar is being recorded. I also am placing a link right now into the chat for a survey. If you can please fill out that survey, that would be great feedback for us. That's how we know what our members are looking for in professional development. So that would definitely be helpful for us. Now I'd like to welcome Stephen and Pamela from ConnectiCOSH. Did I say that right?
Mm-hmm.
ConnectiCOSH, who will be presenting today's webinar, Diversity and Inclusion in Healthcare. Very important topic. But before I give them the floor, though, I just want to let you know that Rosemary, one of our AFT Connecticut's communications department employees, is going to be snapping some pictures of us throughout the night. So just to, post and to promote our professional development programs on our social media. All right, Stephen and Pamela, take it away.
So we are ConnectiCOSH, the Connecticut Council on Occupational Safety and Health, and we're here to do a workshop on cultural diversity. And of course, we'll focus on healthcare because that's who we have with us today. Before we go further, I'm Pamela Puchalski. The Assistant Director of ConnectiCOSH, and we have two board members here who I'd like to have them introduce themselves.
Go ahead, Ashley.
Hi, I'm Ashley Collins. I'm a board member for COSH, and I work as a retention specialist for the Harford County Workforce Development Board. So I essentially help our returning citizens train and get employment.
And I'm Steve Schrag, and I've been active in ConnectiCOSH since the early 1980s. I spent 30 years as a health and safety organizer for SCIU, both at the international and local level. So dealing with cultural diversity is not a new issue for my union. I'm just like you, I represent a lot of nurses and healthcare workers that face challenges like this. And so I'm excited that we're able to share this with you.
ConnectiCOSH is a nonprofit organization who believes that workers can stay safer and healthier if they are educated, supported, and trained about how to stay safe and healthy in a workplace. That's our mission. Before we go into the program, the training today, we just want you to take note of this. We are looking, of course, for worker trainers and or for people to help advise on curriculum. So there'll be a little bit more at the end about that, but just something for you to think about as we go through this. Okay. Steve?
Yeah, I think we'd like to start off with finding out, what are your expectations? What do you hope to get out of this training today? This discussion. Pam, can you break people into smaller groups so they can spend a couple of minutes talking to each other about what their expectations are?
I am sharing the screen right now, so let's see.
I think you have to break out of that and then go into breakout rooms and break it, and they'll ask you how many groups and how many people do we have here today? You have 11.
Let me see.
It says under participant, it says 11. So.
Oh.
How many breakout rooms do we want?
2, 3.
Okay, I'm just assigning it automatically.
So you'll be asked to join a breakout room. So I would like to go into that breakout room and spend a couple of minutes with other people talking about, what do you want to get out of this training? What are your expectations? So while we're waiting, let's hear from people about your expectations. What are people's expectations? From one of the groups, somebody want to tell us some of the expectations in your group?
I think from our group, we just wanted to have a better understanding of how to communicate with everybody, to help us have better care, give them better care, and to just help heal relationships, so we can be better.
Okay. What else? Anybody else? Yvonne, you want to talk about what we talked about in our group?
Yvonne, you're on mute.
So ours goes under communication too. Better to be able to have conversations amongst coworkers without feeling like you have to be against each other.
Okay. Anybody else? Anybody else have any other expectations for tonight? When you clicked on at 6 o'clock, what were you thinking was going to happen? And nobody else has any other expectations? They just showed up, didn't have anything, and they didn't think about what they were going to get out of this tonight?
I
Or what
think
they
in my
wanted?
group, yeah, I think in my group, there was some uncertainty of what to expect.
Was unsure what they expected, right?
Yeah,
Yeah,
but
well,
everyone is open to learning a different perspective, though. That's what it's about.
see, we're always interested in hearing what your expectations are. We know what our goals were based on what we put together, but we're always interested in hearing what your expectations are. All right, so Pam, you want to go to the let me see if I can save this here. Hold on.
Yeah, I'm going to wait because I don't want to get rid of that if that's what.
Okay, so it should be saved now. All right, good. So you want to go to the our goals?
Okay.
So this is what our goals were when we thought about this, because we've done this with other groups as well, is to help people feel comfortable at work, help create a work environment that focuses on quality care, because we've done this for nursing home workers and other workers, develop a calm conversation to increase mutual respect for all. So I hope our goals match up at least somewhat with what your goals were, your expectations. Pam, you want to talk a minute or two about what ConnectiCOSH is?
I did that.
You did that already? Okay.
Yes. I'm
You
going
want
to
to
go
go to
to
ground rules?
our ground rules is today we'll start with respecting each other, reducing background noise, and staying on mute unless you have something that you'd like to share, which of course is always welcome. Please try to restrict distractions so that you can be as present as possible for today. And please do ask questions and participate or offer, thoughts and feelings either in the thought or if the moment seems right, you are welcome to unmute yourself. And the chat rooms are typically the best place to at least put your thoughts if it's hard to find a good break in the action to offer something. And please enjoy yourself. So our first activity today is the dress. So could everybody put in the chat what colors they believe that this dress is? Or are, I guess. And I'm unable to see the chat because I'm sharing screen. So if other people can, maybe Ashley, you could let me know what people are seeing.
The first one is Sherry, blue and black. Yvonne says gold and white. Of course, I say white and gold, like I said last time. Blue and black from Rosemary. White and gold from Dale.
Anyone else?
Oh, I had blue and black too.
Blue.
Okay.
Okay, thank you, Marianne. Blue and black.
So, Ashley,
going-
what are you seeing, Ashley?
I see, I believe it's only 1, 2, 4 blue and blacks and 3 gold and white so far.
But what colors are you seeing?
Oh, white and gold.
Yes, I'm seeing white and gold as well. What about you, Steve?
Tonight I see white and gold.
So am I. Okay. Nobody's wrong here. Hold on. Nobody's wrong. This dress is actually black and royal blue. And but for some reason, some people see it as white and gold and others see it as black and blue. Tonight, I'm seeing it in white and gold. And this is a great exercise in showing differences in human perception. So what do you all think that this tells us about individual perceptions when we look at this dress and all of us looking at the same thing see different? Again, if there's anything in the chat, please, Ashley or Steve.
How is that possible? How can it, I just don't understand. How do you see white and gold? And I see blue and black in a picture on a computer screen. I don't understand that.
They don't really totally 100% know why. I know for me, when I first saw this, back in 2015, I did see a blue and black dress. The last few times I've looked at it, I see a gold and white dress. So what is it? Is it something in our eyes? Is it something in our brain? It is not known, but what is important to get out of this is the fact that we can all look at one thing and just see it differently. And, we use this activity at kind of to start us off to demonstrate that we all have different perceptions sometimes of the very same event or a person, or how a person reacts. What one person may see as a negative behavior, somebody else may not. So does anyone have any thoughts?
Has this happened to any of you where you've looked at something and saw one thing and somebody else looked at the same thing and saw something different?
Don't forget to unmute yourself if you're sharing.
All the time.
All the time. Can you think of one example where there's been something as starkly different as this?
Well, I work in the emergency room. So one night we had a particularly difficult situation where a child had passed away. And I was watching the mom, and I just thought her reaction to her son's death was odd. But then talking to other people, they were like, no, she's just in shock. Like, that's a normal way to respond at this moment with her son's death. So like everyone just had a different perception of how she was acting,
Yep.
So in that moment, we might have looked at her and thought she's cold or, something, but I've experienced something similar. And in the years down the road, the person who had acted somewhat, I won't say coldly, but almost matter of fact about the passing of someone was probably more affected than anyone by that person's passing. So any other examples of workplace incidents that again, there were different perceptions of the same event?
I think you picked an interesting one when thinking about death in the workplace, because you all must face that all the time, right? My sister-in-law is a nurse at Waterbury Hospital, and we've talked about it over the years, and it's a very difficult job that you all face, because you face something every day that some of us only face periodically. Do you think that affects how you react to it?
Absolutely. I definitely react differently now to a patient dying than I did when I first started.
Well, I'm going to stop sharing because Ashley is going to start with another activity.
It's going to be just a lot of information. Some of it that you don't see every day, you don't read about it. Like some of it I didn't recall reading in history books in school. So it's an interesting perspective. And we are going to move the toolbar. Why does this feel like it's not the one I was working on? Because it's not. Hold on one second, guys. Okay. Sorry, guys. One more second.
For years, I've done worker training, and people have always said, well, you know, when we used to do in-person training, people used to say, well, what do you need, Steve? Do you need a projector or something like that? I said, no, all I need is a wall space and workers, because I don't want to take the chance that there's a technological problem. And of course, now we live with this every day. This is our challenge.
Right. It's an annoying challenge to have. And so I'm going to be going over the history timeline of Jesus. I'm sorry, guys. This little bar is just in the way. I need to hide it. The history timeline of from 1840s to present day. Which of these events are evidence of racism, discrimination, prejudice, and why? So in the 1840s, you'll find that as I go through the different decades, some have a lot of events and some have very little. So like the 1840s, in 1844, the American Party, also known as the Know Nothings, formed, which had an openly anti-immigrant and anti-Catholic policy vowing to elect native-born citizens. There was also the Bible riots in Philadelphia, Pennsylvania, which destroyed the houses and torched the churches of Catholic and Irish people. In 1848, we had the Mexican-American War Treaty that required Mexico concede a little under half of its land to the U.S. for $15 million. Between 1848 and 1860, at least 163 Mexicans were lynched in California alone. In 1849, the Order of the Star-Spangled Banner formed in New York, were anti-Catholic, anti-Irish, and anti-German. Then we move into the 1850s. We have the 1854, the American Party. Again, captured all, what happened? No, sorry guys. Captured all state offices and mandated the reading of the King James Bible in public schools, disbanded Irish militia units, confiscated their weapons, and deported nearly 300 Irish back to Liverpool because they were a drain on public treasury. Also during this time, the anti-Catholic mob in Ellsworth, Maine, dragged a Jesuit priest into the streets and stripped him, then poured hot tar and feathers on him. Pretty violent. We also have in 1855, the Louisville, Kentucky Know Nothing members launched street fights against German and Irish Catholics on Election Day. Immigrant homes were ransacked and torched. Between 20 and 100 people were killed. No one was ever prosecuted for the Bloody Monday. Abraham Lincoln criticized the Know Nothings for wanting to change. I can't see the bottom half of the slide, guys. I'm sorry. I'm going to skip that one, but I'm going to go back to the bottom one. And then 1919 is not supposed to be there, and it should be back in another slide where it talks about 1959. We jumped a whole other century. But in 1959, San Francisco began segregating Chinese school children. And when we think about where we are today, that really isn't that long ago, guys. Just something to think about as I share more of the timeline. In the 1870s, the Naturalization Act allowed for Africans and whites to become citizens, but not Asians because they could not be assimilated. Also, San Francisco drops the requirement to educate Chinese children. In 1871, the Chinese massacre in Los Angeles, 500 white and Latino rioters lynched 17 to 20 Chinese immigrants. The 8 that were convicted of manslaughter had their convictions overturned. There's a lot of information, you guys. So how are you processing it? Is it just straight racism? Is it prejudice and discrimination? What are you thinking right now with just those 4 decades of challenging events?
All of the above.
Pretty violent too. Like these aren't things that we learn in all of the textbooks in school.
Yeah, I don't remember learning any of this.
Right? Like I was going through the slides and I was like, wait a minute, they didn't share that. And we still have so much more. Continued for 1870, we have the Page Act, which prohibited entry into the U.S. of Chinese women who were considered immoral. 1879, the California Constitution prohibited the employment of Chinese people by state and local governments. That's very discriminatory. In 1880s, we have the 1882, the Chinese Exclusion Act, which excluded Chinese laborers, skilled and unskilled, and those employed in mining from entering the country for 10 years with the penalty of imprisonment or deportation. and we're slowly approaching the 1900s, but see, we still have so many things going on. And did we notice that it's really targeted at the Chinese people and the Mexican people during this time frame, and how that compares to today? The connection where it just never stops, the cycle just keeps going. In 1891, New Orleans, Louisiana, one of the largest mass lynchings in the American history of 11 Italians. And in 1899, in Toulouse, Louisiana, 3 Italian-American shopkeepers were lynched because they had treated Blacks in the shops the same as whites. A vigilante mob also hanged 2 bystanders. So I'm sorry, I misspoke. It was Irish, it was Italian, it was Mexican, and it was Chinese. And it's really unfortunate how these things just seem to keep going. And most of the facts that Steve shared with us came from this earlier time period. It's kind of scary, guys. I'll keep going. In the 1900s, we have 1907. The Dillingham Commission concluded that Italian immigrants had innate criminal properties, and Polish immigrants were unstable and had personality disorders. In the 1910s, California alien land law prevented land ownership among Japanese citizens. In 1915, the Ku Klux Klan targeted immigrants, Blacks, Catholics, Italians, and other Southern Europeans. In 1917, the Bisbee deportation, the illegal deportation of about 1,300 striking mine workers from Bisbee, Arizona. They were transported 200 miles in cattle cars for 16 hours without food or water. The U.S. Justice Department imprisoned 4,000 plus German aliens who were forced to buy war bonds to show their loyalty to the U.S. The Red Cross barred individuals with German initials from joining. 1918, the Porvenir Massacre was when Texas Rangers executed 15 Mexicans in Presidio County, Texas. Any thoughts so far? Feelings, what's going on?
It's not getting any better.
Unfortunately.
Not a very nice world we live in.
No, you're right.
But you know what I'm thinking is that I was born, nobody can repeat this, but at 55, and you know, in the early 1900s, Irish Americans were still being
John, we're having a hard time hearing you.
discriminated against. And, you know, I thank my family in instilling in me, you know, how to, but I'm just talking about the fact that the Irish Americans were treated poorly in the early 1900s. And I'm thankful that that was passed on by my family. And yet I'm ashamed that many Irish Americans today are the ones who are perpetrating bigotry.
John, there's
really-
nothing wrong with 1955. That's when I was born too.
It is really unfortunate, John, because it just seems like no matter how, sometimes it feels like no matter how much forward movement, you're still gonna have a few that just can't get past those negative things, right? And I'm glad that you erased better than that. In the 1920s, we have 1921, the Emergency Quota Act restricted immigration according to national origin of who was already in the United States in 1910, which excluded more from Southern and Eastern Europe. Immigration Act of the 1924 banned Japanese and Asians from entering the U.S. limited immigration according to nation of origin, who was already in the United States in the 1890s. Keeping in mind that in that same time frame that they're talking about, they were being deported and treated really poorly. Between 1848 and 1928, an estimated 597 Mexicans were lynched. 1929, National Origins Formula capped a total immigration at 150,000 and had to match current ethnicity distribution. It's a lot of stuff going on. Okay, I want to move my, yeah, here we go. In the 1930s, the 1930s really wasn't that long ago, just a little over 85 years ago, 86 years ago. The Mexican repatriation program deported more than 500,000 people. About 60% of them were United States citizens. This was less than 100 years ago. In 1933, there was a KKK rally against Italian immigrants in Vineland, New Jersey, where 20% of the population were of Italian background. In the 1940s, an estimated 112 to 120,000 Japanese migrants and citizens incarcerated in 10 American concentration camps. In 1943, the expansion of the Californian alien land law denying Japanese from the opportunity to farm. In 1945, California law facilitated the seizure of land owned by American descendants of Japanese. In the 1950s, 1951, between 1882 and 1951, statistics reported that 4,730 persons were lynched, 1,293 white, and 3,437 were Black.
And the unfortunate thing is there was no video of any of those lynchings.
No. And again, that we were still dealing with limited access to medias, being able to engage more people because of all the discrimination and blatant racism that was going on.
There was a movement in the 30s and 40s to pass a federal law to make it a federal crime to lynch people.
Mm-hmm.
That bill never passed.
And here we are in 2021.
Yep. Actually, Ashley, I refer to the current Black Lives Matter movement as Black Lives Matter 2.0.
Right, we talked about that.
1.0 was the anti-lynching movement of the 1930s because it was exactly the same issues that we face today.
And then we're just going to round it out with the more recent things. But again, you can see that a lot of the stuff happened in the late 1800s, it moved on to now. And even in this last slide, we know, especially in the wake of the pandemic and just really being forced to look at the things that are going on, even though, you know, we're used to being out and about, we know there's so much more that has happened between 1976 and 2019. But in 1976, Douglas, Arizona, 3 campesinos were kidnapped, stripped, hogtied, and their feet burned and told to go back to Mexico. In 1982, Vincent Chin, a Chinese American, is beaten to death when he was mistaken to be Japanese. This was like just 3 years before I was born. Like that was like yesterday, it feels like. In 1994, California voters approved Proposition 187, which made undocumented immigrants ineligible for public health, public social services, and public education. This was in 94. And
So,
Ashley,
let me ask them a question.
Yep.
What's the impact on healthcare if you make it illegal for undocumented immigrants to become eligible for it? What is the impact on healthcare? Do you think there's an impact on healthcare for everybody else because some people can't get any healthcare at all?
Yeah, definitely is. Yeah, I mean, let's just take where we are right now. If people, illegal immigrants couldn't get the COVID vaccine, they would be showing up at our hospitals with COVID.
Exactly. And
Spreading to everybody else.
And even
Yeah, and
before,
they would put lots of other people at risk, not just themselves. That's correct. And that's exactly what happened with multi-drug resistant tuberculosis in the early 1990s when TB is very similar to SARS-CoV, that it's an airborne pathogen. And poor people then didn't always have access to healthcare. So lots of people who were living in congregate housing and who didn't have access to healthcare got sick. Well, because they got sick, they put other people at risk. That's just as true today too.
Mm-hmm.
I'm sorry, Ashley, go ahead.
Oh no, you're fine. You are absolutely fine.
This is Gail. Can I make a comment? I worked in California in the 80s, and a lot of women would bypass the San Diego hospitals and come up to the LA county hospitals and fit in the parking lot and then come in and deliver their babies. And it's interesting about this law in the 1990s, what happened, you know, them trying to make them ineligible for public health. But if we were, I never saw so much no prenatal care when I worked out there. And that was before we had all the high-tech care for premature babies too. So the hospitals were full of undocumented newborns. It's interesting.
it's quite a challenge in healthcare, isn't it? When there's some people that don't have any kind of coverage.
Right.
Right.
And it's a shame our country really shouldn't be like that in this country.
Yeah, we the unfortunate thing, and this is not going to be news to any of you, we spend the most of any country in the world per capita on healthcare, and we don't get the best outcomes of any other country.
Huh.
Our infant mortality rate and our life expectancy is not even in the top 20 now. But yeah,
Right.
per capita, we spend more per person than anybody else. Something wrong with that picture, right?
Yeah.
Guys, I just want to share something digressing back to the dress. So I opened up the PowerPoint slide to get some missing information, and on my phone, it is blue and black. Interesting.
When you
When I
pulled
looked
up
at it-
this slide, when you pulled up the beginning of your slideshow and I looked to the left and I seen all the slides, it was white and gold for me.
Huh. And it's
Interesting.
interesting that I'm looking, I don't know if you guys can see. Oh, yeah, my camera.
Mhm.
Huh. Wait, it was black and blue when I was looking at it initially, and when I looked to show you, it's white and gold. Craziness. That's all I have. That's craziness.
It's a
Perspective.
visual phenomenon that they don't really understand why, but it does illustrate that when we look, we can all look at the same thing and see something different.
It was a little bit freaky just now because I swear it was black and blue. Our next one is in 2011. NASA banned from using funds to host Chinese visitors at space facilities. This is 20 years ago. 20 years ago. In
10 years
28
ago.
No, 10 years ago.
10
10
Jesus
years
Christ.
ago.
I don't talk about it. Oh my God, that makes it worse. 10 years ago. That's like yesterday. Like what?
Mhm.
Yeah, no. Life was very okay. 2018, US increased visa restrictions on Chinese nationality students and scholars. A presidential advisor proposed banning all Chinese nationality students. These are things they don't talk about in the news
Mhm.
at all.
And this is before COVID.
Before COVID.
Mhm.
Now it's just louder because people are forced to pay attention now. And in 2019, Walmart store in El Paso, Texas shooting, which resulted in 23 people dead and 23 injured, almost all of whom were Hispanic Americans and or Mexicans. The suspect, Patrick Crucius, told the police that he was trying to kill as many Mexicans as possible. That's a bit traumatizing. We know there's so many more things from 2019 to 2021 that we don't have to further elaborate on, but what are you guys thinking? What are you feeling as it relates to what do all of these things have in common and what can we learn from them so that we don't repeat them, even though it seems like we keep repeating them?
Honestly, a little depressing.
A little bit. I'm sorry. That wasn't the goal.
I think it kind of illustrates that we're always looking to make somebody else the scapegoat and the other and dehumanize those people and blame them for all the social ills or economic ills or whatever that are going on and wherever it is.
And it just doesn't seem to change. How do you think that plays a role in how it goes now? Because we know during that time period, a lot of the time period I just talked about, there wasn't a lot of news. There was barely any TV. You had the newspaper, and it had to be someone of value, depending on clearly who they felt had the most valuable opinion, right? So if you were Chinese, if you were Italian, if you were Jewish, if you were Irish, whatever the case may be, they weren't listening to you then. Is that any different from where we are today?
I think it has changed a little bit for that certain ethnicity.
Mm-hmm.
Well, I mean, maybe not for the Chinese at this point because of COVID and people like blaming them for it, but
Mm-hmm.
there was a period of time when people would look at people I don't think they see Japan like they did, during the wars.
Right.
Because now they look at them as being very smart and, they kind of want them to come to our universities and work with us because a lot of people.
Do you think that's because the Japanese have changed or people's perception of them have changed?
Their perception has changed.
Yeah.
And the assumed value, I think, too.
Right.
Because at one point, society treated them as, invaluable. They were disposable, and now they're seen as an asset. Sometimes we have our ideologies, like, a lot of people say, oh, if you're Asian, you're smart with math, you're good with numbers.
Right.
Like things like that, now they have a value based on whatever has happened within our government. And now it's like, okay, fine. But now we're going to go after the Chinese people because they brought COVID over here. Oh my goodness, how dare they? When I just learned in the slide that they've been a target for many years by the government. And it's gross, something that they hid until there was an opportunity to go, oh, hey, while we're talking about this, let's do this as well. Any other thoughts?
I think the focus changes on the nationality, the race, depending on who they feel threatened by,
Hmm.
right? It's sad. I'm like lost for words. It's sad.
Pretty heavy set of slides.
So Mary Ellen, I have a question for you. Who's the queen of misinformation?
Marjorie Taylor Greene.
Oh, she was in Plainfield, huh?
Yes, she was.
Oh my goodness. I'm glad I didn't know about it.
Oh, is she there? I drove past that and she was there. Oh my God. Yeah,
I think
those
she
are-
was the guest of
Yeah.
honor.
Yeah.
Well,
oh my goodness.
there's some people in I live in Waterbury. There's some people in Cheshire and Prospect who protest every Sunday. And they're against vaccines, they're against masks for their kids. They don't believe the election results. And it's a very ragtag group. But you know, listen, I'm a first person to believe that they have a right to protest. The unfortunate thing is they are spreading misinformation. That's a challenge, isn't it?
I think it's particularly a huge challenge now because
Yeah.
I mean, we look back like 200 years ago when, you know, the news was limited and areas were relying mostly on their local newspapers and courier, you know, what was the mail service that would kind of bring the news from the east to the west. But now, you know, there's almost too much news, not vetted news.
Well,
Definitely saturated.
unfortunately, there's lots of things spread out there. I guess I would hesitate to use the word news. Maybe it's still news, but unfortunately, there's lots of it is factless, you know?
Right, just it's a lot of information. And so
Yeah.
now you really have to take the time to kind of like dissect it and figure out what's accurate, what's not accurate. And, you know, what do we do from there? But clearly we still have some more work to do. But I think it's possible. I think that with the access to more information, I think that is beneficial in making change because you get to highlight what hasn't changed, despite what, you know, maybe big government or politicians might say, like, oh, no, that's not an issue here anymore. But when you have people on the ground that can show you their lived experience, it's there. It shows that don't believe everything you're hearing on the media. You have to be on the ground and be talking to the people and seeing it and be about the change.
And you have to always remember that people's perspectives are different. They can look at the same event, the same situation, but have a different perspective. Is it because of their background? You know, different cultures have different backgrounds, and that makes it makes them maybe less likely to appreciate one perspective. So it's always good to look at someone else's perspective, whether or not you agree with it, in order to move forward with improving communication with someone else.
My father used to tell me, walk a mile in somebody else's shoes before you judge them too quickly.
Yep. And I think we have to think that way about all people. Even sometimes the people that are carrying signs and things that we don't agree with.
Absolutely.
So, all right,
And
I'm
I
going
think
to
having access to the information as well, because just like just now, everyone here learned a bunch of things we didn't know. And so when we don't have access to this kind of information to show us that it's not just something small that really is significant or it's been happening for a long time, the more people know, the better choices they can make. You know, I think John mentioned earlier about, you know, being Italian and things that like listening to the things and knowing the things with his lived experience. It's like, wait a minute. Like, what do we need to do to change it? And what happened for people to go negative after being treated negatively? You know what I mean? Just how can we change that conversation and that dynamic? Thank you, guys.
There we go. Okay. Oops, let me, I need to get into a quote that I'm going to be reading to you from Martin Luther King's 1955 Montgomery bus boycott speech. I want you to listen to it, and there's going to be some questions that we're going to ask afterwards. My friends, we are certainly very happy to see each of you out this evening for serious business. We are here in a general sense because first and foremost, we are American citizens, and we are determined to apply our citizenship to the fullness of its meaning. We are also here because of our love of democracy, because of our deep-seated belief that democracy transformed from this paper to thick action is the greatest form of government on earth. Just the other day, just last Thursday to be exact, one of the finest citizens in Montgomery, not one of the finest Negro citizens, but one of the finest citizens in Montgomery was taken from a bus and carried to jail, and because she refused to get up and give her seat to a white person. So I'm urging you now, we have the facilities for you to get to your jobs. We have the cabs there at your service. Automobiles will be at your service. And don't be afraid to use up any of the gas. If you have it, if you are fortunate enough to have a little money, use it for a good cause. Now, my automobile is going to be in it. It has been in it. And I'm not concerned about how much gas I'm going to use. I want to see this thing work. And we will not be content until oppression is wiped out of Montgomery and really out of America. We won't be content until that is done. We are merely insisting on the dignity and worth of every human personality. And I don't stand here. I'm not arguing for any selfish person. I've never been on a bus in Montgomery, but I would be less than a Christian if I stood back and said, because I don't ride the bus, I don't have to ride a bus, that it doesn't concern me. I will not be content. I can hear a voice saying, if you do it unto the least of these, my brother, you do it unto me, and I won't rest. I will face intimidation and everything else, along with these other stalwart fighters for democracy and for citizenship. We don't mind it as long as justice comes out of it. And I've come to see now that as we struggle for our rights, maybe some of them will have to die. But somebody said, if a man doesn't have something that he will die for, he is not fit to live. So I'm going to go.
By the way, in case anybody's interested and curious, the price of a gallon of gas in 1954 was 29 cents a gallon. Because I think it's interesting that King related to telling people not to worry about spending money on gas. 29 cents a gallon in 1954.
Okay. So the first question. So what did you hear Reverend Martin Luther King say in this speech concerning the main reason that they gathered? Was it A, to fight for new legislation, B, apply their citizenship to the fullness of its meaning, or C, learn about how to drive buses? What do you think?
B.
Correct. What happened to one of the finest citizens of Montgomery who refused to give up her seat to a white person?
It was carried off.
C.
See,
See,
Good. What should people not be afraid of? Using gas, fear itself, or getting to work on time?
using gas.
That's right.
B.
Good. Somebody was listening. What needs to be wiped out in Montgomery?
see,
Hey,
C.
Very good. And what will the Reverend King face? Harassment, intimidation, or threats?
B.
B.
Wow.
probably all three.
Oh, yeah.
Yeah, probably all three is right. Yeah.
Yes, you are right. But if you were listening, it sounds like you were, because you got all those questions right. You can see the answers to these questions here. What do you think he was saying in this?
That every human being has the right to sit on a bus and not give up their seat.
That's right.
We're all the same.
The respect and dignity doesn't know color.
Right.
And we need to come together
And
and
if
put
they do-
ourselves out there.
And if they're doing it to my fellow neighbor, they're doing it to me.
Mhm.
That's right.
That's right. And even if you don't have to, you don't need to ride a bus. You can still stand up for someone who does. All right. I believe this is Ashley.
Listening skills assessment. Rank yourself using A, B, C, or D for the following. A, most of the time. B, frequently. C, occasionally. D, almost never. Number 1, I tune people out to say something you don't agree with or don't want to hear. Would that be A, B, C, or D for you? You could type it in the chat if it's easier.
Oh, yeah.
Anybody want to answer?
C.
Thank you, Yvonne
Yeah.
and Sherry. And that's understandable sometimes. We have a B too. I can respect that as well. Okay. Anyone else?
Probably more C.
Thank you. Number 2, I concentrate on what is being said, even if you're not really interested.
B most of the time.
B sounds about right. Anyone else?
Yeah, much to my wife's chagrin, I watch MSNBC, CNN, and Fox. So the last one would fall on to number 2 for my wife. She's not happy that I'm listening to them, but I do want to hear what they have to say.
Because it's valuable. Mm-hmm.
It's another perspective.
Mm-hmm. Number 3, assume you know what the talker is going to say and stop listening. Ugh. Yeah, I'm guilty of that one. Somewhere
Same.
between B and C, depending.
I actually work on that one sometimes.
Yeah,
I have to focus.
yeah. I have a miniature person, and they tend to repeat themselves. So I usually know what she's gonna say.
I was gonna say, it depends on who you're talking to. 'Cause some people
Right.
know what's gonna come out of their mouth before they even open it. So,
Don't even bother. Right. And number
That
4,
sounds like family dinners to me.
that's accurate, Steve.
Actually,
That's-
one of the things that I've noted over the years, the challenge at family dinners is people are not necessarily listening to each other at all. They're waiting, when they're being polite, they wait their turn to talk, but they don't necessarily respond to what the previous person says. They're just waiting to say what they want to say.
Yeah.
That's very true.
They're not really listening to each other.
You're right. And sometimes, like, if I'm really interested, I'll stop the whole conversation. Like, no, we have to go back. You got to say it again. Kind of liked what you said, even if I was the only person that heard it. Number 4, you listen to the other person's viewpoint, even if it differs from yours. I'm gonna say
C.
yeah.
C.
most of the time.
I have to admit, with COVID at work sometimes and the vaccine and that kind of stuff, I have a hard time with that, listening to even different
Oh,
people.
that's understandable.
I must tell you, this has been a challenging one for me because since SARS-CoV hit, I can't listen to any of these infectious disease people on television because they're not telling people the whole story. From the very beginning, this is what I spent years working on at SEIU on hazardous materials and emerging diseases. And if from the very beginning they had been issuing personal protective equipment, N95s to everybody, we would not have had the catastrophe that we've had. So to
Mhm.
hear these infectious disease people talk about it, it's been very frustrating for me.
I'm right there with you. No contact tracing in the
Oh,
hospital.
yeah, they have no, when they assign HR to do contact tracing, they have no idea, appreciation of what contact tracing really is.
Oh, we just don't even do it. We don't tell our patients that their nurse had got COVID, came down with COVID.
For years, I dealt with our members that work in hospitals who would go into rooms where they find out 2 days later that that person had TB.
Mhm.
The signage
Yeah.
and the information provided to people was terrible. They
Yeah.
weren't in a negative pressure room and they weren't told that they needed to wear an N95. Only been made worse by SARS-CoV.
Yeah.
Right. And the ironic thing is I sat and did education at work the other day and it was on PPE and it says, take your N95 off when you leave that patient's room and dispose of it. Well, why aren't we doing that? Yet you're telling me to watch this education, telling me the right way.
Well, the reality is, if you look on the boxes of N95s, they say disposable.
Yeah.
You would not in good conscience wear the same gloves from one patient to the next, would you?
Exactly.
Right.
Yeah. Well, good infection control requires that those N95s be treated like gloves, that they're disposable. The unfortunate thing is that in a world where where there's an unfortunate scarcity of them, I understand why people reuse them. But pre-SARS-CoV, those were thrown away like nothing because they are nothing. I must tell you, for years, we would go to conferences, worker safety conferences, and firefighters would look at us and say, you call that N95 a respirator? I'll show you a respirator, because firefighters obviously have to deal with toxic materials during a fire. So they're wearing a self-contained breathing apparatus, which is a full face with a tank on their back. Now, I would never expect healthcare workers to wear that, but they used to make fun of us fighting for N95. So they said, that isn't even really a respirator. What we use is a respirator.
Yep.
Number 5, learn something from each person you meet, even if it's ever so slight. A, most of the time. B, frequently. C, occasionally. Or D, almost never.
B.
C.
Accurate. Number
Why
6.
is this so important?
Because they won't share with you if they think you're judging them.
Right?
I also
And-
think it kind of validates their humanity. If you can find one thing about them that's
That's correct.
interesting or that you like, you can bond with that person.
That is exactly right. And the fact is, because you've never walked in their shoes, they may bring something to you that you've never experienced. You don't know that until you hear it.
I was going to say the same thing. And you never know. I've had people say things to me and it wasn't relevant until like 5-10 years later. And then it all makes sense. So that's just something to keep in mind. Number 6, find out what words mean when they are used in ways that are not familiar to you. I want to say that's an A for me. If I've never heard it used in that way, I'm going to look it up, like usually on the spot. Anyone else?
That's how busy I am.
Except when my kids talk now, sometimes I have no idea what they're saying.
Yeah, they're using initials, and we have to get a special dictionary for all those initials, right?
Some of them don't make sense at all. Number 7, give the appearance of listening when you aren't.
This is about our spouses, isn't it?
I was gonna say not like, when we're multitasking on Zooms, but when we're doing things at the same time. It happens. I'm gonna say I try
Occasionally.
not to make it B, but definitely C.
Mhm.
Agree.
That's just
Same.
what it is sometimes. Right? We're all human. It happens. Depends on where we are, what we're doing. Number 8, listen to the whole message. Listen to the whole message what the talker is saying verbally and non-verbally. I'd say for myself, if that's between a B and a C. Since I work with people a lot, I rely a lot on what they're not saying with their bodies.
And therein lies the challenge with Zoom, because
Mhm.
we can't get any of your nonverbal communication on a Zoom.
Right. Anyone else?
Well,
Number
I'm probably
9. Oh, go ahead.
Yeah,
Go ahead.
no, go ahead.
No, you go.
No, I was gonna say I'm more of a B because I really believe in the nonverbal. Even
Mhm.
talking to your kids on the phone. If
Right.
you don't hear them, you don't know what they mean. A text doesn't count.
Right.
I hate text because it doesn't give you any of the intonation.
Right.
Right.
So
Right.
for me, it's most of the time because I'm a psych nurse, so I have to look at the nonverbal.
You have to be
Mhm.
able to do an assessment that looks at the nonverbal, because you may not get much verbal, right?
Right.
So when we're in healthcare, we definitely should be trying to aim towards B, nay, right? Because we need that. It's a lot of the times what we don't say. And then 9, recognize that words don't mean the same thing to different people. That's a struggle, right?
Mhm.
Because we all are different. And when we think about where we come from, the people we're used to being around, saying something in one group might be okay. And for another group, it's like, what are you talking about? Where did that come from? What does that mean? Anyone else?
I was going to ask Yvonne, when she's dealing with these psych patients, how is it when you're looking and attempting to understand what they're saying, does it seem to make a difference in how they appear in terms of physically how they are, how they're dressed, how they're,
Absolutely.
you know?
If you're telling me that you're fine, but your hair is disheveled and you haven't taken a shower in a few days and you're not making any eye contact, I mean, there's so many cues that the nonverbal can tell you about what they're saying, whether what they're saying matches what they're presenting.
Mhm.
So Yvonne, what do you make of video therapy?
Yeah, I haven't had to do that, so I don't know. I don't know because I haven't had to use that. I would say that unless you're looking at the whole body in the video, you're not getting the whole picture.
I had quite a discussion with a friend of mine who's a psych nurse, and she said there are people who are getting therapy online. They would never come in. So there's people who are getting something they would not get at all if they didn't have video therapy. And I raised the question. I say, I understand that, but what about the quality of the therapy? And she says, well, obviously it's limited.
I would agree with that.
There's a yin and yang in there, right?
Oh, yeah, absolutely.
And number 10, listen to the talker without judging or criticizing.
B.
I'll let you guys go first. Is it situational for you?
Yeah, I think it depends on the person. If I've had experience with them in the past, then those experiences might have lead me to be judgmental and or critical.
And I think the judgmental and critical piece is, do you actually say it or do you think it? And you know what I mean? There's a big difference there. But
that is one of the difference in definitions between discrimination, prejudice, and racism, right?
Right.
Racism is actions that oppress people. We all are prejudiced and discriminating in one way or another.
Right.
The question is, do you act on it?
right.
And I would hope that our group would be saying no.
Right.
But
yeah. Well, that's our challenge is the difference between what we think and what we do.
Right.
And how do we begin to change what we're thinking?
That's right.
Okay.
Did you want me to do this one too?
It looks
Your
like
name is
that.
next to it.
Oh,
Mhm.
hey. Sorry, guys, I didn't find that note. So good communication, we're talking about, things that we do often, some things that we don't really do, maybe we should be doing more. How do you define good communication?
I think it's more than just expressing yourself well, but also ensuring that the person heard what you actually said or how you meant it and intended it. And then allowing them to respond back to you.
Not just talking, but listening.
Making it a dialogue, not just a monologue.
Right. And we know that there's a difference between hearing and listening, right? Like I heard what you said. That was cool. That's fine. You got it out. Thank you. But listening, really processing and flipping the roles to see how it would feel if the shoe was on the other foot. And I know you guys work in healthcare, so it's not just being from the clinical aspect or the nursing aspect, but how would you feel if you were that patient receiving the care or the family having the conversation? Like what are some important pieces for you? How do you expect to receive communication? And how do you think you're communicating with the people that you work with, whether it's your colleagues or your patients?
Well, I think that's the problem in healthcare right now and why a lot of nurses are feeling burnt out and having some moral injury because they can't do great communication with their coworkers or their patients because it's just so busy and so short-staffed, and it's really all just about checking off a box for a task, and that's not why most of us got into healthcare, and that's the problem we have right now.
Most analysis of quality healthcare includes adequate time with nurses. That's quite frankly, you see your nurse more than you do a doctor.
Yeah.
Right. And when nurses can't spend the time with people, literally spend time, just time, not just doing a procedure, but spending time with them, the quality of the care does not get better, it gets worse.
Right. Right. And the outside pressures from people thinking that, okay, as a nurse, you're just giving meds and patching people up. But it really is that connection, the communicating with your patients, right? Whether you're, like I said, clinical or nursing staff, just being able to connect with them or being able to ask your colleague, check in with them, right? Because we're under a lot of pressure, and being able to say, hey, you're doing great. Or, hey, how can I support you? Or, hey, I need 5 minutes to recollect myself. Being able to communicate that is really crucial to being effective, right?
Mhm.
And what are some ways you think it can be improved within your respective fields? What do you think are things that will be helpful to you to better define good communication and be able to show others how to communicate better?
I feel like just, being able to just spend that time where you actually talk about other things other than work is important sometimes, because that helps you form relationships and trust. And then you guys will go along longer with it. You'll go a lot further with each other. Like you can go through a lot more with each other on a bad shift and have a lot more patience and understanding and try to look at someone else's perspectives. If you trust them and know who they are as a person, like if you're able to say, oh, she's just lazy, or she's just, flighty, or she's just this, she's just that. But if you know them and you know how they are with their kids and how they are with their spouse and how like you guys have on, like a depth thing, you're more likely to give them the benefit of the doubt. They're like, oh man, maybe she didn't get enough sleep last night, or maybe she didn't have her morning coffee or something. She's just having a bad day, and you're just willing to give her the benefit of the doubt. Him the benefit.
Coffee is important.
Do you all do a huddle at the beginning of a shift or the end of a shift?
Yeah.
Are you supposed to do it? Like, is it as
Yeah, we're
meaningful?
supposed to, but it doesn't happen because it's so busy.
Because obviously one of the things that analysis about quality of care is the handoff between shifts is so crucial.
Yeah.
Right. That one shift needs to tell the other shift what's going on with this patient or whatnot. And that huddle at the beginning or end of a shift is crucial for that. And in lots of places, they don't have time to do those huddles,
That's dangerous.
Yeah.
Right. Not even just for the nurses, for the patients, for everybody.
Oh, yeah.
So one piece of communication what I do not think is good communication, and I think Dale and Connie would definitely back me up on this, is volumes of emails and stuff from management telling you what the policies are and how to do this, and here's the flow chart, and and expecting that to be good communication. And I always say shit doesn't go uphill. All that shit comes down and nothing from us ever goes up.
Well, it's interesting you say that, because it's unfortunate. It's in lots of different places that people now email is a lazy way to communicate, because they think because they sent it, you read it. And they think because they sent it, you read it, you understood it, and you buy into it. And one does not lead to the other. When I worked for my union local before I retired in January, and I was recruiting people for things, I would send an email, I would send a text, and I would call, because I never presumed that everybody reads their emails or even their texts. I would do all three. And so not having the full loop of communication, you can't know whether, so just because you send the email doesn't mean people read it. And now I'm the recipient of it because I'm not working full-time anymore. I don't read my emails as much as I used to. And people will call me and say, well, did you read that email I sent you 2 days ago? I said, no, I haven't caught up to 4 days ago.
So as healthcare providers, where do you feel that communication is most lacking? From upline, with patients' families, with each other? Where are you all feeling the greatest lack of communication?
Well, unfortunately, I feel like everywhere, but mostly because things just keep changing so rapidly at this point that it's hard to stay up to date with what's the newest thing to say to patients and the newest thing to say to families, and what we're doing, what we're not doing. And I think the public's frustrated, we're frustrated, and it just leads to two frustrated people trying to communicate, which is never a good thing.
And where is all that, I won't say misinformation, but convoluted, changing information coming from?
Management. I mean, and I get it, like some of that's coming from above them with people like Stephen was saying, the infectious disease people, it's frequently changing. So they get the changes from the CDC and WHO, and then and then upper level management changes policies, and then policies get brought down to us, and then we have to filter it out to the families and patients, and they're like, well, I was admitted last week and I didn't have to have this done, and last week I could have this many people in, or I didn't have to wear my mask in the room this time I was here, and it's just frustrating.
My union represents lots of healthcare workers in New York, and we worked with them when New York State required as a condition of employment to get the annual flu vaccine.
Right.
And so I'm very familiar with this issue about people being nervous about vaccines, because we had lots of members who were nervous about that one. Well, I'll tell you something. In hospitals where we had worker trainers, where we had their coworkers be the facilitators in the discussion, and they actually had a discussion with people, we got 90% participation. In places where we didn't have that, it was much worse.
Yeah.
So I look at the problem is it's not just the message, it's the messenger that we have going on here. People aren't going to necessarily listen to a government official who they don't know and say they're going to trust them for this. They might trust a coworker who they've worked with for years more.
Yeah.
But I'm also hearing that it would be helpful if they listen to the concerns that are coming from the ground as well.
Yeah.
Because we
Right,
have people making decisions
Yeah.
without realizing the ground level impact that the pandemic is having on the patients, on the workers, on the system in general. So there just needs to be a more transparent means of communicating the concerns so that both roles, both administrative and for the people on the ground, that the intended goal is to ensure that our patients are getting the treatment that they need and that people are leaving healthy, instead of having disgruntled workers and losing patients.
Well, in hospitals, there's more than 25 people. Shouldn't there be worker health and safety committees where
By
people
law, they're
come together?
required. Yeah, by
So-
law.
There are, but they don't listen. The other thing is they do employee surveys. We love these. So everybody's so frustrated right now. They're like, why should I fill that out? I just pulled it out. They didn't listen to me last year. I said,
Or the year before, or the year
Yeah.
before that.
yeah,
Yep.
But they'll hire a consultant and listen
Yeah.
to the consultant who has
You
no
know,
idea.
If I ever wanted to be rich, Mary Ellen, I would go down to Staples and print up a business card that said consultant.
Yeah.
I wanted to
There
be
you go.
rich. That was my goal in life because they pay them an enormous amount of money. And, the fact is a consultant by definition doesn't work there. So unless they're really, really aggressive, they're not going to know what's going on the ground there. So how can they give advice?
Right,
Okay.
exactly.
Good communicators consider the following: understand their assumptions and the other person's assumption. Understand how fast you talk impacts how much someone else's hears. And it's funny because I feel a little bit targeted because I have a tendency to talk really fast.
Me
I'm
too.
excited.
I feel targeted there too.
And sometimes, right, if we're just trying to get it out. So
Ashley, we
lose
didn't
the
put your name
information.
next to that, Ashley.
No, I felt targeted. We're gonna go with it. We're gonna ride that wave. But I know, like as a healthcare professional, when you're trying to communicate something about the issue while moving on to the next, you got 30 seconds to get it all out, and it's like 10 minutes of things. I used to tell people you got to listen better so you can keep up. I remember I had a friend tell me, like, if I walked past you, I thought you were speaking a different language. Like, you really have to be in your conversation. And sometimes I have to remind myself to slow down. But sometimes it's going so fast up here that if I slow it down, we're not going to get
Ashley,
anywhere.
I once did a workshop for people who for up in Massachusetts for what's BESB, which is their agency for people who are blind and deaf. So
Mhm.
I had to do a workshop to a bunch of people who couldn't hear me. So I had to speak slowly enough so the person who next to me was translating it all through sign language could translate it. That was the slowest I've ever talked in my life.
I would just have to type my own notes then because I wouldn't be good at it. It's really hard, especially with the mini, because she tries to talk as fast as I do. It doesn't work out too well. The next one, make clarifying what you're saying a regular habit. So just double checking what you're saying and making sure that people understand, because sometimes we'll say something, right? And like the person's like, yeah, I get it. But they really don't. They just want you to stop talking. Or it was just too much for them to take in, right? Appreciate your style of communication and how it works with others. We're all different. So, sometimes someone could be really transparent in how they're feeling, and that can come off as aggressive or blunt to other individuals. So just being aware of how we're communicating with people and, the possible perspective, but also being able to say, I'm not going to focus on the messenger so much, but they are delivering something that I need to hear. What can I take away from the experience aside from their style of communication? And use open-ended questions to understand others better. It opens the door for perspective and for, more understanding, as some of you guys pointed out, as what we should do to make things better. Team, is there another slide?
Yeah, I just did it.
Okay.
It's the
It
same
looks-
title though.
Yeah, that jacked me up a little bit. I was like, okay. Okay, so practice listening with people who you trust to improve your skills. Problem solving rather than winning may help improve connections with others. So it's okay not to be right. I remember working in a different field and they had this thing called motivational interviewing, and it said dancing when you're talking instead of struggling back and forth with the point to be right or be wrong. So being willing to let go of the right way for the best way. How you react to confrontation will determine the outcome. Practice difficult situations before you face them, which I know for all of us could be a challenge in some way, shape, or form, right? Something happens and you're like, ooh, wait till I see you. I'm just going to get it all out. And you're like, maybe I should work on that before it gets taken the wrong way, right? And looking for feedback and suggestions from people you feel will be honest. So if your best friend always is okay with how you are because they love you, right? They might not be the best person to ask for honest feedback, but they might be. Any thoughts? Things do you think we should add to that?
So let me ask you a question. Do you all, in terms of dealing with workplace violence, practice difficult situations before you face them? Is that something that happens as part of do you all have a workplace violence curriculum program in your workplace?
Yeah, we do CPI.
Yeah, but it's like
It's a
once every 10
certification.
years, I think, or something crazy.
Yeah, that's
Ours is every 2 at Danbury.
okay.
And
Well,
you have to have it. You have to have it. You
Yep.
can't even be a patient sitter unless you have it,
well,
because
that's good.
you get
That is
yourself in
good.
trouble otherwise. Well, that's because of union involvement.
That's exactly
Yeah.
right. Mary Consoli and
Okay.
other people fought for that, I'm sure.
Absolutely.
Yep. But it's very important to practice that before it happens, right? You're not going to be prepared to deal with a confrontative patient or family member unless you've practiced it ahead of time.
Steve, this is you.
So we make the road by walking. So if you want to make your workplace more tolerant, what do you need? What else do you need? What skills do you need? What knowledge do you need to gain? What else can help you make your workplace more communicative and a more tolerant place to work? What else do you all need?
You need the skills on how to get other people to buy into it.
Okay, getting other people to buy in. Okay, what else?
And lead by example.
Yeah.
That's a hard one though, isn't it?
Yeah.
What else? Buy in, lead by example. Anything else? Anything else that can help you make your workplace more tolerant?
I think, oh God, I'm sorry, I'm just, never mind.
That's
I'm
all
gonna
right.
just say, be nice to each other. Be nice.
Well,
That goes a long way.
That goes a long way, but the challenge is how to get other people to do it too, right?
Right.
And
Maybe
it's a little
having
harder now with the generation differences.
It is, isn't it? It is.
So maybe working on having an open mind with communicating with our peers and with upper management. And it sounded like we feel like upper management is not hearing you. You gave us a survey last month. You added nothing. We asked for new coffee flavors and you still couldn't do that. So why am I filling out another survey, right? You want to feel heard. So maybe a committee that communicates between your colleagues and upper management so that you can feel more heard. Someone that like represents you in these meetings and things like that. Would
That's
that
what
be
we do
That
as a
helpful?
kind of
union.
segues into this one.
Oh, my.
What else do you think we should do to help increase the respect that you show for each other at work? Is there anything else we can do? I mean, I put up those 4 steps because those are the 4 things I've always used to deal with health and safety problems. That is, what research do we need to do? What education do we need to do? What do we need to do in terms of workplace organization? Pam mentioned the fact that all of you work in workplaces that have 25 or more workers under Connecticut state law, there's required to be a health and safety committee. Joint Commission requires there be a safety committee. Do you all have equal participation in that committee? Does it reflect agendas that of things you care about rather than what management cares about alone? You need to make those committees yours. I know when I say to teachers or healthcare workers committees, they roll their eyes. That's the first thing they do. But those committees can be productive if you take control. If you grab the steering wheel and you make it work, you can make it work. Because I've seen it. But it will not be easy because lots of times management doesn't want to give up the steering wheel.
I think what I was trying to say before and my mind just didn't gel is that we also kind of have to be brave to speak up.
Yep.
And speak up in a way that that we're being respectful, but we're also able to communicate what issues we have for patient safety or intolerant behavior or, nastiness amongst the staff or whatever. We need to be able to bring that up.
And how can you feel most supported so that it's easier for you to be brave? What do you think would help you to feel brave?
It's strength in numbers.
Mm-hmm.
I will tell you, you put your finger on the most important issue. And our goal in these workshops is to help give you the confidence to be brave, to give you information and skills so that you can take this stuff on, because it really doesn't matter what we talk about today. It matters what you do tomorrow. But I always tell people that the two biggest obstacles we have to safer workplaces are what I call the two fear factors. Employers are not afraid of OSHA and workers aren't afraid of their retaliation by their employer. And so helping people be brave is a challenge. But it's one of the most important pieces. You're right.
And how hard is it to be brave when there are enough differences amongst everyone?
Mm-hmm.
You know, how can you find the similarities even with different cultural differences, different gender differences, different approaches to things? You know, where can you find the similarities in your workplace that help you to bring the best patient care to your patients, where you're safe, where you're supported, and where you feel like you're of value?
Is there anything else that we can do to help you with any of these categories or anything else that you need to be braver at work?
No, but if you can teach me how to tell other people how to be braver.
Yeah, yeah.
Well, I'll go twitch my nose and make that happen. How's that?
Okay.
I think the first
Um,
place to start is right here, like you guys are right now. Just
That's
having
right.
open conversation and just laying out, like, not even ground rules, but just saying, hey, let's talk. Like, where are you from? You know, what brings you here? Why'd you get here? You know, what makes you tick? Because I believe Sherry mentioned that earlier. Getting to know people on a personal level helps you to better, you
Build
know, work with
connection.
them, engage
Yep.
them, and build that relationship, even if it's, you know, a small one. You know, even if your patient's only there for a few days compared to your patient that might be there for months or years, however long it takes. You know what I mean? But being able to have an open mind about it, that's the bigger part. Just trying not to internalize everything, because sometimes, you know, a person's demeanor doesn't reflect who they are. It could be reflecting the struggle they're having in the moment. So keeping that in mind too, right? From all sides. Just like when they engage with you, you guys expect the same thing. You don't want to be just barked at. You guys aren't doing enough. You guys are doing an awesome job. So I should say thank you for all of you, what you do, and being on the front line and saving lives. I appreciate you.
So we need your help to help us build our program. So you want to go to the next slide, Pam? So we are always looking to develop curriculum that people care about. So if you're willing to meet once or twice a year to help us look at the curriculum that we're either looking at or give us suggestions for new curriculum to help train people, we're interested in finding 1 or 2 people in your class here tonight to help us do that, to look at what we're currently doing and look at what we should be doing. That's one way you can help us. The next one is we're always looking for people to help us to do the training. So if you're interested in helping to become what we call a worker trainer, that is a worker, a frontline worker who helps train their coworkers around safety issues, we're interested in having you step up. If you're willing to do that, we'll put you through up to a 40-hour train the trainer, where you learn from others on how to facilitate a workshop like this one. Help us recruit and conduct one or more workshops a year, and help us evaluate our training programs. So if there's anybody here who's interested in that, you can put that in the chat. And let us know if you're interested in either being part of our becoming a worker trainer or be part of our curriculum committee. We're always looking for help to build our program. Pam?
So we'd like your thoughts, and that can go in the chat, or if you'd like to verbalize it, about our workshop today. The expectations you had, were they met today by this training? And again, I cannot see the chat at this point.
Nothing there yet, Pam.
Okay.
Well, we really appreciate when you give us feedback. So whatever you can share about what you thought that was helpful to you, or ways that we could do this differently next time to make it better for the next group, we really appreciate that. We pay attention to it. This is not like a management survey that we ignore, I promise you.
Yeah. Did
No.
any of the activities hit you more or less than other ones, that as far as helping you to appreciate cultural diversity and how to be more open to different people and different ways of being?
Mary
I think
Allen
the
says,
education, oh, sorry.
no, you're fine, go ahead.
I think the educational part, when you listed, you know, the years and when things had happened, and was eye-opening. I do think we had great conversations. So I think in that way it was helpful for me to better understand where people were coming from. If I'm going to be honest, I was a little shocked that a lot of the history that you played was not. I expected this to be mostly about Black and brown people. And so when you were putting up things about Irish and Italian and all this other stuff, I was like, oh, wow, you know, like, because I think when I think of racism, I don't necessarily think of them per
Mhm.
se. Or, you know, obviously I mean, I know that there's some religious things, but I don't necessarily, when I think of religious, you know, discrimination, I don't normally think of like Christian Catholic religions anymore, though I know that, you know, that was an issue at some point. I don't know that I necessarily thought of it happening here in the United States.
Or it
You
being
know?
so significant, right? It was
Sherry,
very
you
like,
shouldn't apologize for that because most people don't have a good grasp on this history.
and Sherry, I promise you, as I was talking about going through the PowerPoint slides to try to make them so that everyone could see them, I literally kept stumbling because I'm like, wait, I can't move this around because I'm so caught up in the information. Mary Allen said she wasn't sure what to expect tonight. I thought the discussion was very helpful and the activities helped to start the discussions. Rosemary says, I thought the part about understanding what words mean different things to different people was very impactful, right? And many people don't think about it, and this is true, because sometimes we might hear something or we might, you know, see something and think one thing and it's really not. And lacking that understanding, or even just the fact that it could be much more or much less than what we think it is. And the history, again, opened up our eyes for Miss Yvonne as well, because the history really paints a different picture, right, Sherry? I thought the same thing. Usually when we're thinking diversity and racism and things like that, you know, we talk a lot about Black and brown, but just to see that the Chinese have been enduring this kind of treatment for almost as long, right? Over 100 years, or even, you know, Catholics and Irish and Italian. And even, like I said, as John mentioned earlier, the fact that some of the same groups that were discriminated against in turn did the same thing. So how does that dynamic work, and how do we change it so that we can recognize that at some point we were all not at the top? I don't want to say top, but just, you know, at some point we're all exposed to some level of oppression. And how can we connect to be more impactful, to really connect with each other?
Do you think that this workshop helps create a constructive discussion among coworkers?
I think it would if there were more people in the workshops from the same areas that could, you know, go back to their respective places and start those conversations. I know for me it's difficult because I'm not in the hospital. I'm not amongst my members. I only have communication with them when they have a question or they have an issue. But I hear what's going on, right? Or I get the complaints about the discrimination, the harassment, the different words that are being used, you know, in some instances inappropriately, but that's another workshop. So yeah, I think it would be helpful if more people were educated.
Is it possible to take groups of you from specific areas? I don't know who is the person that organizes these things.
I think it's hard right now because with all of the stress going on at work, it's hard for people to commit to doing even one more thing.
Yeah.
I also think it would be hard, especially considering how short-staffed pretty much every hospital is, to get a group of nurses or a group of other professionals together at the same time without at least 3/4 of you having to be at work.
Right.
So I do know at L&M, we have a diversity and inclusion council, which I am on. And it is like banging your head against the wall to get anybody to do any really meaningful things. And there are some very meaningful things that are being done. But to get people interested in attending some of them, or willing to have a discussion, willing to put themselves out there, hear different people talking about different things, I think it's breaking through that immediate, oh, I already know about that. And, you know, I don't need that kind of thing. How does this affect my job? How does this affect work? It's really, I think, getting to people to understand it's the basis of all our relationships amongst people. And
You know, Mary Ellen, and I'll ask this of everybody, if you'd be willing to give us a quote that says why you think that this might be helpful to deal with that might help recruit other people in.
I'm on it.
You know, if anybody else wants to share with us a quote, one sentence about why you thought this was helpful or might be helpful to other people, that would be helpful, useful in terms of recruiting other people. Because if they hear from participants, it doesn't matter what we say, it matters more what you all say that matters.
So Steve, you might remember this, but I don't remember the quote or the who said it. But there was something about, you know, they came for this one, and
Reinhold Niebuhr it was during the Nazis. Yeah, they came for communists and I wasn't a communist, so I said nothing. They came for Jews and I wasn't a Jew, so I said nothing. Yes. Yes.
Yeah.
Until they came for me and there was no one left to talk.
Right.
Yeah.
Yes. Unfortunately, what's old is new, right?
I think we need to change the people that they're the communists, that part of it.
Yeah.
And put in what's pertinent to us now.
Yeah, I think you're right.
Use that as a quote. And you can use that quote, but then
we could call it a paraphrase. I don't want to make sure he gets credit for it. So we call it a paraphrase of Reinhold Niebuhr.
Correct.
Yes.
Correct.
Yes. I think that's a very good idea.
That's my quote.
Okay. That's your
Good
Fair
job.
enough.
Good job. The last question, will this workshop lead to more respect between workers?
We can get them educated. I think it would.
Mary Ellen says, anytime we can learn something to help us connect with each other, to patients, to coworkers, to friends, to family, to acquaintances, to strangers, it makes life a little bit better for everyone. And I agree with you, Mary Ellen.
Yeah.
And
Ditto
I
for
think
me.
it's helpful too, because it helps you when you're not at work, your family. You know, when we see our family members saying or doing something, it's kind of like you'll think back to what your colleague or your patient told you about experiencing something, and you'll be able to say, hey, no, let me give you a tangible real life example of how what you said or what you did has a significant impact on other people. Like I know for me personally, whatever I learned from groups like this, I teach my 6-year-old. Why? Because she's young enough to still be able to receive it and to be able to make a change. And she can display that character with her peer group. And they learn from her, and you keep going. So imagine if we all did that, with whether it be our children, nieces, nephews, your crazy uncle, your best friend, your sister, whomever, being able to share a little bit of something that you learned or a connection that you made so that we can all be better. Because I think a lot of the information, like we said tonight, especially with the timeline, is isolated. These are not things that are like right there. These are things that are kind of tucked away and hidden in the creases and the crevices, right? And so we don't get to build that kind of respect.
You know, that's a perfect lead into that quote that we had in there that we says we make the road by walking. That's a quote from Paulo Freire, who was a Brazilian educator. And his whole point was, we make the road by what we do. We set the example, right? With the example we set helps make the road. We make it by walking. That's how you make a road.
Very true.
And
you guys did it by being here tonight up until 8 o'clock, hanging out with us. So thank you.
And all change starts from each one of us.
Thank you for your time.
So
Thank you,
before we
guys.
get going though, before we get going, I do just want to say thank you all for joining us this evening. Please remember, I'm gonna put it in the box.
I got
again.
you already. Oh, oh, she did it again.
I got it. Just
You guys
to
are
make sure
fast.
that
Sure, you're on top of it.
fill out the survey so we know other, professional developments. Again, and I also put at the beginning, if you need a certificate of completion, you just email Anna, and her email's at the top of the chat box again, for that. And if you want to see what other professional developments are coming up, we do have one, I believe it's in December, and it's documenting for healthcare professionals. It's a legal documentation one. But you can see the other ones that are coming up at www.aftconnecticut.org. You can just go there and look at the calendar. You can see that. So again, thank you for coming. Thank you for coming in and sharing your presentation with us. We appreciate that.
Our pleasure.
Have a
Thank
good
you for having us.
Thank you so much.
Pamela.